Well, hello, and thank you for joining us. I'm Phyllis Sharps. I am a professor of nursing at the Johns Hopkins School of Nursing and also the Associate Dean for Community Programs and Initiatives. I've been at the School of Nursing for about 20 years, and my research program focuses on women's health and particularly pregnant women and issues around intimate relationships and specifically violence against pregnant women. I think I started out my career, or even when I was in nursing school, really knowing that I wanted to do women's health and mothers and babies. And so it has looked differently sometimes, different groups of women, different aspects of maternal and child health, but that has been the theme under all of my work. It's been the focus of all of my work. And my clinical practice has always been in places where women. And as I continued, what I learned very early in my career, what a lot of people don't also know about me is I started my career as an active duty Army nurse. And what I really started being aware of early in my career is that women of color, particularly Black women, always seem to have much poorer birth outcomes. And even in the military, where everybody gets access to care, there's not an issue of not being able to pay for care, but everyone from the lowliest private first class to the highest general's wife, women have access to care. And so that also made me think a little bit about what was going on. And then when I transitioned back into the civilian workforce, I became much more aware of infant mortality, maternal mortality, and just some of the issues that have persisted in women's health. And so one of the things I would say, I certainly didn't start my graduate program for the PhD thinking about research, but just that I wanted to be a really good teacher. But you also understand that, as you pursue a doctoral degree, you're getting yourself prepared to do research, which I have totally enjoyed the research aspect because in my mind, it's also a different way of doing clinical practice. But I think perhaps the challenges that may have been unsurmountable if I wasn't passionate about the work of women's health and pregnancy is that I often was by myself doing work, and the first kind of challenges were related to, well, why are you getting a PhD in nursing? Why don't you just go to medical school? And I was very naive and I said, well, because I want to be a nurse. And people would just kind of like shake their head. And then I taught at historically Black universities in nursing, and a wonderful experience. It's where I really learned to teach and mentor students, but often those universities are resourced differently. And I came to the understanding that if you wanted to do funded research, you probably needed to be in an infrastructure where there's support to do research, and I came to Hopkins. So I think often the challenge for women of color and women researchers is the populations that we are most interested in exploring are not necessarily the groups that other people are interested in. And very often we're interested in community-based work, and those relationships and working in community take much longer than some other forms of research, or where you're dealing with a captive audience in a hospital setting or a clinic or that kind of thing. And so often you're challenged about your dedication to working with that population, and also knowing that the success of your research also depends on the success of the relationships you build within community. So it's been a very exciting time at Hopkins. I think in the last, 5 to 6 years, as we've gotten much more diversity in our faculty, much more diversity in our doctoral programs, and brilliant young men and women in those programs, which will speak to the quality and the rigor of research, but at the same time incorporating the voices of the people, because too long, I believe majority researchers have been doing research about us as a people without fully understanding the implications or our culture, or even that, some of the behaviors, some of the illnesses and things, the diseases, the disparities, they didn't just happen. They're not biological, but they have also to do with how we've been treated in the 400 plus years that we've been here, and the resources that we often did not have access to. And that's resources across the board, whether it's housing, whether it's education, whether it's health insurance, employment, all of those things. So I'm gonna stop for a few minutes and introduce you to Carissa Lawrence, who's one of our up and coming doctoral students. And let's hear a little bit about her perspectives.
Hi, everyone. My name is Carissa, and I use she, her pronouns. I'm a second year PhD student at the Hopkins School of, at Johns Hopkins through the School of Nursing. And my interests are in health equity, maternal fetal childcare, sexual reproductive health, specifically though for transgender males. And as a certified nurse midwife, women's health nurse practitioner, I realized that there are these major differences, specifically a lack of information for a group of people that we should be including in healthcare that we've been excluding. So I have worked most of my career, not specifically in transgender care, but when I do deal with a patient that comes in, it definitely, you can see all the barriers, all the infrastructure that's not in place to really care for these groups of people. And to me, that's very unfortunate. Happy Pride, it's Pride Month, but truly it should be Happy Pride all throughout the year, right? Because we should not be in a country where people cannot have access to the things that they need to access, to be treated with respect and dignity, to be believed and cared for holistically, right? So although my research career is just really starting to build out, it would behoove me to consider all the work that my predecessors like Dr. Sharps, all the foundation that she's laid out. We have studied extensively the fact that Black women have poor maternal outcomes. And that is a scary thing, that we think of something that would be so natural, but you think about the fact that I've had people say to me, Chris, I just want to hear your voice because, and this is not like a patient of mine, but friends, I just want to hear your voice because I know that I don't know if I'm going to be okay after I go into labor. That's heartbreaking. That's really heartbreaking, And then as a provider, I know that I can do all the things, but if there's a system that's working against us and a system that's, in place to where we can't be believed, and it doesn't matter how much money you have, right? Serena Williams, case in point, she literally had to beg for a scan, right? And it turns out that she had clots in her lungs. Embolisms, those are life-threatening, pulmonary embolisms. That's life-threatening. But not even Serena Williams, with all the money and fame that she has, was believed. There's so much work that we have to do. And I know that Dr. Sharp's legacy shows us like we've come in some ways further, and please correct me if I'm wrong, Dr. Sharps, than when you started your research to now, because you have decades of research under your belt, right? Mm-hmm. we've made some changes, but we're still so far from where we need to be. And although I'm sad that you feel like you've got to pass the torch on and move on and do this other aspect of your life, because you are human, albeit a little superhuman, but you're still human. It is as mentioned before, it is something that is an ongoing battle, that even after your decades of hard work, you're seeing some change, but it tells me that this is going to be forever something that we're working on to continue. It should never be a level of complacency where it's just good enough. It should always be great.
I think, especially in this past year, I've tried not to be discouraged, because I'm probably going to age myself here, but in 1963, when Martin Luther King gave his I Have the Dream speech, I was actually there in DC. And I remember how excited we were and how optimistic we were. And great strides happened after that. But most recently, we've seen something emerge, and it probably was already there, and maybe it kind of was dormant for a while, but it seems to have emerged, which I think reinforces that, as you've said, Carissa, that it is an ongoing struggle. And just as Black women as patients often are not heard, often Black women in leadership roles and inside of the academy are not heard. And so we have to be consistent. And when it is appropriate, use it as, quote, a teachable moment, or help people to become aware, because I think often people don't think about that discrimination works in many ways. And so if we can discriminate and be biased against one group of people, such as transgender individuals, you should watch out, because it could happen to even you with a lot of money, or your whiteness, or any of those things. So that working for a world that accepts diversity and understands that we are only as great as all of the parts of us, the collective body. And just as, I had an example earlier in my career where the discrimination worked in a different way, and doing women's health and maternal and child, we deal with women who are going to breastfeed. And at this particular institution, it was almost implied procedure that every brown or Black woman that came in was screened for drug use. And it happened that we had a white woman, professor in the law school, that came in, and I said, well, how come we didn't screen her? Well, she's a lawyer, and I said, the procedure says we should screen all women, so I think we should screen it. And guess what? She had codeine in her breast milk. Now, she wasn't a substance user. She happened to be using a codeine-based cough syrup. But suppose we had missed that, and there wasn't the opportunity to talk to that woman about things that she needed to consider while she's breastfeeding, rather than just stereotype because she's white and well-educated and a professor. We can kind of skip some activities. And so, again, because of the work I do with violence against women, I found it's just better to ask everyone, because people that you maybe intellectually wouldn't think about will sometimes admit to things that you would have missed, and you miss and us as a helping profession, you miss the opportunity to connect them to resources or any of those kind of things. So I think what Carissa is saying, and I think our younger generation of folks and researchers coming into the field will continue to advocate for all groups of patients, because we cannot afford to continue to let bias and discrimination and prejudice inform our practice and our research.
Absolutely.
And there is clear evidence through NIH and other places that diverse research teams craft and develop interventions that are far more feasible, sustainable, and make a difference than when you have a more homogeneous team. So.
And that's because I think, Dr. Sharps, that the perspectives matter. The varying perspectives matter. Everyone's truth is very personal. Our truths are shaped by the world we live in, the people around us, the things that we experience, right? So we watch the same movie, we generally might say the same thing, but we saw different things in the movie because these are our truths. It's all perspectives. So when we include a team that represents a diverse body of people, we get those varying perspectives. Is it all the perspectives? Absolutely not. But it gives us something to work with to where we don't have to just think about it in this simple box, right? Mm-hmm. And that drug screening thing has been one of the bones of contention in my practice for so long because we use so much judgment. And I think judgment is problematic for so many things. And when a lot of times I feel like that judgment comes in, it's very negative, right? We broad assumptions, and we paint a picture of individuals who may not even be associated with that picture that you've created based on these judgments, not you personally, but that we create. And which is one of the reasons why, so I'm working on, I'm a part of a team of people working on looking at the curriculum for how LGBTQ information is dispersed in the textbook, how the language is used, is the language even used, and in what context? Because the way we train our professionals, we literally use our textbooks as guides. We have our professors, we have everything, but we read. And as for me, I read and I absorb. So, and then when I'm tested on what I read, really, right? The notes, the lecture slides, all those things. So we have to begin to look at how we're training our people to care for these populations and really invest in that. You know, this past year, growing up in New York City, I've seen a lot of things. But just living in this place for even the short amount of time that I've been here, I've seen a lot of things. And in the last year, I've always felt motivated and empowered and inspired by people. But in the last year, I don't know if it's the sick of being sick and tired, or just really feeling like searching deep within myself, but I am so motivated now more than ever to push that change, because when we elevate when we elevate like Black women, all groups of people get elevated. Every single group of people end up succeeding and prospering. So we need to invest in this. We need to invest in that overall health and well-being, because those things are important to move our community as a whole, right? Globally, nationally, in the right direction. And that testing with the judgments and those things, that's why we're stuck. We're stuck. Yeah. We're passing these judgments and we're doing these things. So the researcher that I want to be, I want to check my biases because I'm human. They'll be there. It is anyone who says they're not biased on some level for something, it's not true, because we all have our cultures that shape us. If you are religious, you have religion, your communities and friends. But I want to be that researcher that carries on, you know, and uses your legacy and carries on your work in a way in which I can see people. Not necessarily by race and sex, but like their individual identities and how they identify, right? That intersectionality of being, the many things that shape them. So I'm hoping I do a good job. I'm confident that I will do a good job. But I can be certain that I know that you did an excellent job, and those are big shoes to fill.
I think sometimes too, it's the challenge of finding your niche and being able to withstand the challenges. And really, and that's why I think passion and commitment is so important, because they're going to be, no matter how good a researcher you are, or how well educated, or how great your team is, there's just going to be challenges. And the comments you made about the team and the diversity, is so important. And also, I mean, there's been research that documents that more diverse teams and teams that include people of color more likely are to approach any of the phenomenon they're interested from, for instance, a more resilience framework than a problem. And part of healthcare professions are, of course, we are trained to look at problems, critique problems, and that kind of thing. But when you start from a strength-based, resilience focus, you see things, as you have said, prospectively, you see things very differently. And in my own field, I mean, I started working with a group of researchers that were interested in a whole lot of factors related to violence and why some partners murder each other, and a lot of description, which I know as a researcher, you've got to understand the phenomenon and the epidemiology of it. But I look at those homicide records. I remember I was sitting in the police department of Baltimore abstracting records, homicide records of women who had been murdered by partners. And I thought, first of all, how did I as a nurse get here? And then second of all, I started thinking, but gosh, is there something we could do before families get to that point? And so again, that's that kind of resilience, strength. And so much of the work I've done has been more about interventions, which are it's a different challenge than sometimes the epidemiological or discovery research is, but also that as researchers being comfortable that we need all aspects. And in our community where there are so many needs, I think we often are challenged by building resources and networks where people perceive that there's going to be some help, and not just study us and describe us and point out, all the weaknesses. And it kind of, I've heard several times, and I love this, and I often repeat this: nothing about us without us. Basically, community needs to be involved if that's where your intention is going to be. And I think sometimes, it's just very challenging when you are, I think, Carissa, what you're going to find is the network of Black PhD nurse researchers is small. It probably seems very huge to you now, but when you start networking and doing the work, but knowing how and when you can take a stand, but also be safe. Because often there's more at stake for researchers of color, that if we, I won't say challenge, but if we voice something that perhaps you should consider this, or have you thought about this, we then either are seen to be challenging or not a team player. If you enter into a quote heated discussion, then you become an angry, hostile person. So how do you manage all of that, but also alerting and increasing the awareness of people and teams and funders and other folks that you are working with to understand, that there's a different perspective on either rules or guidelines or things that people are implementing and hold fast to without always thinking about the long-term consequences on some populations and maybe all populations. And then the one other thing that resonated with me when you talked about women, and I think that that is why I have been so committed and passionate about women's health, and particularly around pregnancy and maternal outcomes, because when you empower a woman or give her the tools or the help or the resources she needs to feel successful and confident in her parenting, mothering, caretaking roles, the whole family, the whole community benefits. And I remember we did some work with our international school here at Hopkins, and at one point we had the first woman president of the World Bank, and she made a comment that until societies fully employ women at the capacity that they're able to be employed and have them in leadership roles across all sectors of our society, so business, politics, education, we will never be the kind of country or world that we will be. And I thought, that just says it all to me, that women, yes, we may have a different perspective, we may come about it in a different way, but we need, just as we need male voices and diverse voices, we need women as researchers and leaders to challenge some of the tougher problems I think we face.
So Dr. Sharps, this leads me to ask a question, like, how did you finesse those things? How did you find the right words to say when you needed to elevate, you know, your question or your concern without being the angry Black woman, angry nurse researcher? Like, how did you do that? Because as a starting researcher, essentially, these are the tools that I'm gonna need to at least get me through the next few years for sure.
Well, I guess I've been blessed. I have a quiet demeanor, and often in meetings, I do a lot more listening. So when I did speak, people were first of all amazed that I spoke, but I could use my quiet voice to make a comment about whatever the discussion was. And often you have to also, it will change a lot, I'm sure for you, but often I would be in a place where I was the only woman of color, the only nurse, and no one had ever seen a nurse researcher, let alone a Black woman nurse researcher. So I often would plant what I had to say. Sometimes it resonated, but other times it didn't. And I would, I could have a little bit of humor. And lately I've been calling myself a one-note Charlie, but and they look at me and I said, you know what I'm going to say? You know what I'm going to bring up about the diversity issue, or, whatever it was that they were discussing. And then the one piece of advice that I got from my dissertation advisor, who at the time was the only woman of color in the doctoral program where I went to school. She's a very young PhD, just really smart. She said, sometimes you just don't need to ask permission because people can say no. So if I was really keen on doing something, or somebody told me that it couldn't be done, it just kind of tick something else, and I'm going to show you it can be done. And I would not necessarily say that. And sometimes, I went around to a different door. I won't say the back door, but I found a different way to get in. And then, and I was fortunate that most of the time when I did that alternate thing, it did work. And so then people, I would never say, I told you so, but I enjoyed the look when it's like, whoa, this really, work. I think about, before I came to Hopkins, I was on the admissions committee. I was at the George Washington University School of Public Health. I was the first director of their maternal and child health track. And so I had a lot to do with admissions. And the way the committee was set up is that if the admission officers could not make the decision, they would give the person on the borderline or something, they would give it to the committee. And I would say everyone that I recommended, even though the rest of the committee said no, there was something else. Usually it was a person of color. I do an interview, but you could hear the motivation. All of those people came in, nobody flunked out, and all of them have gone on to really great leadership roles in public health. So it's sometimes encouraging. In the case of the advocacy I've done for admissions to graduate programs, is just to really help people look at different things more holistically. And even in our own PhD program here, when I was on the admissions committee, you know, I made it known that for some of our students of color, they are the first persons, one, to have in their families who have gone to college, and then probably the first person to get to doctoral level. And you all, you know, maybe you have been used to that, or, you know, you have lots of friends. And so there are rules that are written, and then there are more informal rules. And I don't think that you can necessarily penalize folks because they don't know about these assumptions that you make, which are those informal rules kind of thing. And you know, a lot of that goes on in the admissions committees. And so you have to kind of be willing to speak out on that sometimes. And it can be a hard place to be. It can be a hard place to be.
I definitely appreciate your pearls, because it's the diplomatic approach. It's an approach that allows for you to find the right avenue to enact what you need to get done, to really, you know, sometimes it's being quiet and sometimes it is making a little bit of noise, but just knowing the when and how to do it, I think. And then our cohort is the largest cohort, and we have the most diverse cohort in my PhD cohort year. So I think, although I don't think that I won't be the only in any situation. I know that in my class, looking around and seeing the diversity of faces, it makes all the difference. Yeah. Like our experiences and the way we interact and the way we network and link, it makes all the difference, especially for conversation and rich dialogue. And in this last year, you add the pandemic,
yes,
on top of racial inequity. We are dealing with a totally different kind of feeling going into our PhD, our first years. Yeah. Which, you know, we were completely online for a program that would have been in person. But we shared some really intense things, because this year has definitely shaped us a lot. And one of the things I appreciate is that we are looking at race, critical race theory, critical social theory, Black feminism. We're having these candid discussions about how these things play into our frameworks for research. Those are the things we're looking at for our frameworks.
Well, you know, and there's been a fallout in our master's entry, which is, you know, the first level that some students come into nurse, where I've had the fun, and you know how long it's been since I've taught fundamentals, but I've had the fundamentals teachers come to me and ask me to look at things or slides or, you know, that kind of thing. And I do recall that when I first came, students would say to me, then we had a baccalaureate, you know, why are all the test questions about so-and-so who's African-American and substance use and So I think, if nothing else, the pandemic has increased the awareness of how, I think we as a people really understand how devastating and how incorporated into the fabric of America racism is. But I think for many other people, it was an awareness and a step back and a look at how fundamentally it is in all of our, across everything we do in this society. And as a country, I don't think we've ever really dealt with it.
Agreed.
So, and now what's also happening, which I think is going to continue to propel it, is we are becoming a country where the traditional majority will not be the majority. Now, they do have the money and the power, which in a capitalistic society like our country, yeah. But you can't keep well-educated and where diverse groups, they're not going to stay there forever. And there's no, when people talk about make America great, they're talking about returning to, pre-civil rights times. That train has left the station and it's never coming back. So, and I think the same. I've done some work in Saudi Arabia. We started a program there. And I had the opportunity to visit a university that was a women's university, all women. And I went away thinking they cannot continue to educate women and expect them to stay in the kind of roles that's parts of their religion and culture dictates. And, it's just a matter of time. And I think that's kind of what we're seeing here, is that people are going to talk to you about and challenge you about and help you understand that what we see today, a lot of what we see today in our country is the result of the longstanding racism. It didn't just happen overnight. Kind of thing.
Thank you so much for that, Dr. Sharps, because I think a lot of people are taken aback at times, like, oh my gosh, this is America? Like, yes, this has always been happening, always been happening. And I think the pandemic coupled with the sadness in George Floyd and Breonna Taylor, Ahmaud Arbery, everything compounded all at once, created this big explosion and the curtains opened.
Mm-hmm.
Right? You couldn't hide it. It was everywhere. Coupled, you add in social media, things spread like wildfire.
Yeah.
Right? All around the world. So seeing these things, living these things, it really was, I don't want to say reassuring, but it gave me some sense of like being okay and knowing that even in my classmates, they saw this and they were like, oh, we have to do better. And these are the researchers and we have all diverse backgrounds and interests. But you're right, that train has left the station. Great again? How about we just make it great? Let's just start there.
Yeah. Well, it's there are one of the things I do think that as a people, both Native Americans and African Americans in the US, we could learn from our Jewish colleagues. They will never ever let you forget the Holocaust. As many people, particularly Black people, have been the victims of racism as victims in the Holocaust. And my husband and I had the good fortune of going, we went to a research conference that was in Czechoslovakia, and we had a chance to go to Auschwitz, and you look at that and the museums and the things that have been preserved, and you just wonder, how is it that people hate people so much? How does that happen? And in America, we certainly did it with African Americans. We did it with the Native Americans, and it's time to, I don't know, I guess you can never erase hatred, but just to kind of manage it and maybe substitute it with respect, acceptance of differences, and all that it can add, rather than differences somehow is not a good thing. If we could move towards that, I think we would just see such a different kind of place, different world. I don't know that many people know that the system, while we criticized apartheid in South Africa, the systems and the tenets came from what people learned about how we treated slaves over here. We're not, although we've advocated for social and human rights around the world, we're not exactly in this country innocent victims, people either. So we have to keep mindful. And I think if there was nothing else that we could teach our young kids even before they get to college or school, is that we are a resilient people. We have, and we still continue to contend with a lot of things. And as the great poet said, and still I rise. Yeah, we are still standing. I think we're getting stronger. And I think we just have to keep mindful of the work we do. And I'm very encouraged to see the awesome, phenomenal, diverse scholars that are coming into our school in nursing. I think it's going to be good for the profession. We're not, in the many years that I've been a nurse, the profession has not diversified as much as it should. We're still overwhelmingly a profession of white women. And then when you think about higher education and nursing research, as you go up the pyramid of nursing, we're very small at the top. I think it's 3 to 4% of all nurse researchers are women of color.
There's still a lot of.
We need you.
I'm not going anywhere.
No matter how tough it gets, remember, Dr. Sharp said we need you.
I won't go anywhere. I mean, there's still a lot of work to be done for sure. But as you said, Still I Rise, and Maya Angelou is one of my faves, even as a young kid. There is so much that she says that I think if she were alive in this day and age, I mean, she would be heartbroken, but she would also find so much inspiration in so many things. And I think as long as we as a people and we as providers and researchers continue to give care for all gender diverse individuals and have an open mind and open heart, I think that we will continue on the right track. But people have to check their biases. People have to, and we have to give space for healing. I feel like we've gone through so many pivotal things in history, and there's never really a space of healing. And after the last year, more than ever, advocating for mental health and really pushing these things to the forefront, because healing is important to getting to that next step. So I think that we have come so far. Still looking, we're not at the top. We've got work to do. So boots on the ground, pen to the paper, we've got to push forward. And so I'm hoping that in the next few years I can get that foundation to really stir up the right amount of good trouble.
Yeah. And I think I am confident that in terms of methods, biostats, all of those things you need to be successful at a researcher, you will get the grounding here at Hopkins. But you will spread your wings and go different places and make great impact upon the profession, but you'll have that strong foundation because, at Hopkins, I'm going to say the party line, we pride ourselves in preparing leaders in practice, research, and education. So you're going to be out there in research.
But don't worry, Dr. Sharps, I'll spread my wings and come knock on your door Sunday dinner, Wednesday dinner, Saturday barbecue. And all, we can do it.
Well, one of the jokes, just to be lighthearted, I have a colleague that we've done all of our research together, and early in our relationship, we found out that we both like ice cream. And so whenever we would get together, start a meeting, we'd start with ice cream. And some of our best studies were jotted down on the napkins. And people laugh at that, but we'd be eating the ice cream, and I guess we'd kind of relax, and the ideas started flowing, and we'd write it down. So by the time we got back to the office, it was just kind of putting the rigor around it and that kind of thing. So I think, one of my mottos has been always to work hard and play hard. So,
I think I love that motto. I live by that motto.
Yeah, yeah.
I love ice cream, so I might have to bug you for that too. But I definitely think I'm hopeful and inspired, but I know that you won't be too far away
No, I'm
because
not going anywhere.
you'll always be entrenched in Hopkins and your work in your community and all that you've done. Super inspiring, and it is rewarding. It's rewarding.
Yeah,
It's hard work and
yeah.
rewarding. So I think this is a perfect time to just kind of wrap up our conversation.
Yeah, it's been fun. I thank you for acknowledging Pride Week. I have not been able to take my eyes off of your frame, but I think again, it just shows you how important it is to really fully embrace the diversity of all of us. And so thank you. It's been an enjoyable chat.
It's been wonderful. Thank you so much, Dr. Sharps.
Okay, thank you, Carissa. Bye.
Bye.